a locum ends up being a doctor. I guess traditionally it's a doctor or a parishioner, from the definition, that travels to places to basically relieve and step in for someone else, whether they're sick, whether they just need a break or on vacation, or whether they're just understaffed. And so what I do is I'm a member of a group, and so we know what these locums are coming up. There's a list that says, these communities are in need of doctors for this period of time. It could be anywhere from a day to a year or two, and you can set this up months to just even like a week in advance. And so we'll look at what communities are in need and what communities we'd like to visit. And so that's one of the great aspects of it, is that you can travel around and see the country. You can see and experience all these communities, these cultures, and these geographies that you haven't got the chance to, and work and play at the same time. It's invaluable for the doctors who are there, because a lot of them in these communities, they're starved for doctors, and the ones that even do have enough doctors are often overworked, and it can be really tough to get a break. And so if you can't get anyone to replace you, you can't go anywhere. You can't take your family on a vacation. You can't get some rest and relaxation. So people get burnt out, and it's important for someone to be able to take over for at least even a week or 2 weeks to step in, so that people have that continuity of care. And if you choose the same areas to locum to, so if you experience a number of locums and you go to communities repeatedly, you get to really know the people, and it's like a homecoming every time you come back. The doctors are there and they're happy to see you, and even sometimes community members just come pick us up at the hospital because they're happy that we're back. And the learning curve's a lot less steep. You kind of settle in right away, and you know the routine, and it's great.